Hi guys, welcome back to my channel. So today's video is actually a requested video from one of my viewers. And the question was, how do you know if you have PCOS? How does a doctor go about diagnosing you with PCOS? So let me just get right into it. PCOS, as you may know by now, stands for polycystic ovarian syndrome. And once you hear that name, it's really easy to assume that in order to have PCOS, you have to have cysts in your ovaries. This is actually not true at all. 50% of women who have PCOS have no cysts in their ovaries, and I'm one of them. I have none. So what you have to keep in mind is that PCOS is really, at the end of the day, a metabolic and an endocrine issue more than anything. And it manifests differently in different women. You may have symptom A, B, and C and not have symptom D, E, and F, and have PCOS. Whereas I have PCOS and I may not have A, B, and C, but have D, E, and F. So it manifests really differently in all types of people, and there's no really cut and dry way to diagnose PCOS. But there are general symptoms that a physician can look out for when it comes to the diagnosis process. So when you go see a doctor, the doctor should really be doing 4 things. The first thing that he or she needs to do is take your history. Ask you, when did you have your first period? When was your last period? How often do you have your periods? And ask you more questions about, your flow during your period and whether you have any symptoms while you have your period, etc. And then they should ask you, your weight fluctuations. When is the lowest that you have weighed in your adult life? When's the highest that you have weighed in your adult life? Do you notice that your weight goes up and down a lot? Do you notice that during most of your adult life you have been overweight? And these are the questions that they really should be asking you in terms of getting your history. And also important, do you have any family members who have PCOS? Do you have any family members who have diabetes? Because guys, let's remember, PCOS really stems from insulin resistance. So if your dad has diabetes, the chances of you having PCOS now becomes a little bit higher. And then the second thing that they need to do is perform a physical exam. PCOS can affect you from head to toe. And again, as I said before, it manifests differently in different women. But what they really should be looking to see is, does she have hair loss? Does she have acne? Does she have unusual body hair growth? Does she have abdominal obesity? PCOS women tend to be top heavy and not have as much fat in their hip and butt area. So that's another clue that they can look out for. So again, like I said before, not every PCOS woman is not going to have the same symptoms. You may have hair loss and have PCOS, and another person may not have hair loss and have PCOS. But again, they really should be looking for clues from your physique as well to see, could she potentially have PCOS? And the third thing that they should be doing is doing blood tests on you. They really should be checking for, the basic blood profile, lipid profile, looking at your hormones, check your testosterone, estrogen, progesterone. PCOS is associated, of course, with high androgen levels, but again, not true for all women. You can have completely normal testosterone and have PCOS, because sometimes it's not really about the levels, it's about the sensitivity to the hormone that you may have. You may have a completely normal testosterone level, even have low testosterone, and your body just could be that sensitive to the testosterone that you have. And also another thing that they can look out for is look at the LH-FSH ratio. When they do the LH test and the FSH test, and then look at that ratio, if it's higher than 2, chances of you having PCOS now become higher. And then the fourth thing that they need to do, of course, is do an ultrasound to see if you have cysts in your ovaries. Although, as I said before, you do not have to have cysts. An ultrasound is absolutely an important diagnostic tool in trying to figure out, whether you have PCOS, and to check and see, if you have cysts, so that they can monitor these cysts over time. So if you were listening to all I was saying before, what I'm really trying to emphasize is there are so many different ways PCOS manifests in women. There's no one way. You need an expert diagnostician who has seen many different types of PCOS and just doesn't kick you out of the office saying, you have no cysts in your ovaries, you do not have PCOS. You need someone who is passionate about PCOS and is extremely experienced in treating women with PCOS. And of course, it is to your advantage to be as well educated in PCOS as you can possibly be, so that if you do happen to come across a physician who seems kind of dismissive of your symptoms, or just dismisses that you have PCOS just because you don't have this one symptom, then this physician is not the one for you, so that you can seek out a second opinion or another physician who will hopefully be more aware of PCOS and more willing to work with you. That being said, it doesn't mean you definitely have PCOS, but you certainly want a physician who is very, very well educated in PCOS for sure. So I hope that all of this was helpful in terms of learning a little bit more about the diagnosis process, and everything that I mentioned above, especially the first part, the history, and also the second part, which is observing your body. I think is really important in terms of keeping track of your progress when it comes to your health, and also seeking out medical opinion when you need it to be so. So if you have any questions, please let me know. Please comment, like, and subscribe. And I'm very responsive in my comments, so please feel free to reach out. And if anything here was confusing to you, please leave a comment and I will get back to you as soon as possible. All right, take care. Bye-bye.